Violent incidents recently are reviving a huge and really deep discussion about mental illness and the need for a comprehensive approach to mental health. So joining us this morning to talk about this very important subject, Dr. Kari, president of the Seton Mind Institute. Explain to me a little bit about this institute before we delve into the real problem here.
So the Seton Mind Institute is the group of physicians and psychologists psychiatrists and psychologists who provide mental health care throughout the Seton network. We have some outpatient clinics. We also provide coverage in the Seton Psychiatric Emergency Department at Seton Shoal Creek and the other med-surg hospitals.
Okay, what are you seeing out there as far as the problem of mental illness? Is it on the rise? Is it steady? Is it something that we see declining?
It's definitely not declining. The statistics show that it's on the rise. I'm not sure it's actually on the rise or we're better recognizing it now.
There you go.
We've historically just kind of swept it under the carpet and not acknowledged it, but I think we're recognizing it a lot more right now. The big thing we're seeing is people can't access the care. We have seen at Seton since January, a 50% increase in the number of people presenting in crisis, in a psychiatric crisis, who have no way to pay for their care.
And tell us why that is so important to know that that increase affects really everyone out there.
Well, we know that depression especially is very treatable, but all mental illness is treatable. Depression happens to be more treatable than most of our common disorders, heart disease, diabetes, etc. We would never dream of denying somebody access to treatment for their heart disease, but we do it all the time with mental health.
Right. Why would you do that to mental health? Travis County, how are we doing as a county when it comes to tackling this issue?
We're doing better than many places in Texas, but we're still far, far behind the curve.
What is the answer then?
Well, there are lots of answers, but one answer is really just access to care. Getting people the funding in their health benefits to cover these illnesses so that they can get the care that they need.
Okay, so that takes us to the top, the federal level.
Yes.
Then, right? So how can we change it from the top so that it trickles down to the bottom through counties all over?
Well, there are a number of bills right now before the legislature in D.C. that address mental health reform. Some of the fundamental concepts are that we have people in our jails. The jails are the #1 provider of behavioral health services in this country. That's just wrong.
Mind-boggling.
So we need to get those people the treatment they need, not put them in correctional institutions. The other is really enforcing the Parity law. The Parity law passed several years ago,
yes.
Yet we're still not enforcing it on a national scale. Some insurance companies are. They have equal benefits for the behavioral health and the medical, but many are not, and Parity actually does not even cover the federal programs like Medicare and Medicaid.
Why? Why is this happening? Why are we not covering something that is so significant and unfortunately so widespread? Somebody who's probably hearing this is thinking, I would like to get some help, but maybe I can't.
Yeah, I don't know why we've done it. It's grown up for decades in separate funding systems. So the behavioral health funding system is completely separate from the medical funding system at the federal level, and that's allowed it to be discriminated against, cuts made repeatedly, and we're trying now to reintegrate those two systems.
Okay, well, thank you for all that you do, Dr. Wolf. I know it's such a big problem, and you're helping with everything that you can. So we appreciate you.
Thank you.